Hi, we have Rajesh today with us from Pellucid. Pellucid has been doing some extraordinary work on the medical side. Rajesh, why don't you explain us about Pellucid?
Oh, sure. Thank you, first of all. And my name is Rajesh. I'm the co-founder of Pellucid Networks. What we do is fairly simple. To actually put it in simple words, we take diagnosis online. That's about it.
Good. So, how did you bump on this idea, Rajesh? Are you a doctor or something?
Not really. I'm not a
Okay.
doctor. But I've been associated with selling healthcare products in my past stint. And the technology brains is really not me. It's my other co-founder. His name is Ravindran. So he has about 16 years of healthcare experience, particularly in technology. He was associated with GE, was a part of a company called as Manmar, which was one of the first healthcare product companies in India. It was actually the first healthcare product companies in India.
Okay.
And I myself have a lot of sales and business development experience. I was selling enterprise products from Singapore and a lot of healthcare products as well. So the team brings about quite a lot of experience in healthcare, and we really saw that healthcare was one opportunity or one area where there was a lot of opportunities to use healthcare to completely transform the area. So that's essentially what we are doing currently.
So, are you also helping to improve the overall quality? Because diagnosis is one area where each lab has a different set of findings to speak.
That's
So,
right.
is that something you're trying to bring a
Uh,
quality onto it?
Well, the fundamental area that we really work on is not really the pathology part of it, which is all your, your blood, the urine, and all of that, but more towards the imaging part, which means X-rays, MRIs, CTs, ultrasounds, pathology slides, endoscopy, and all those things. So principally, what we do is, we are able to move all these large images very securely and very swiftly over the internet connections. And you also need a lot of applications which to diagnose these medical data. So what we have done also is we have built browser-based technology so that you don't really need an install. You don't really need to install anything, but applications can be served on demand on a pay-per-use model. So that's principally what we do. End result is, of course, we do improve quality, but more than that, what we really do is we bring reach. So the whole idea is to bring healthcare to the common man at the lowest cost quantum, and that's essentially our focus.
But the diagnosis is done by algorithms or it is by some panel of doctors and stuff?
Okay, a number of things. We are working with Arvind Eye Hospital where we have a sort of semi-automated diagnostic tool. This is for the eye area. This is for ophthalmology. But for radiology and all of that, it's purely we send the images to a specialist, we give them the tools to diagnose, and it's the human who actually does it.
What kind of team you have right now, Rajesh, and
At the
what's your
moment,
roadmap?
we have a pretty small, young, and vibrant team. We have about 20 people, mostly in terms of technology and technologists. At the moment, the plan of action is really to scale the sales team. So I'm looking at hiring a lot of really smart and focused sales people who could help me propagate the product to the market. So that's really the core focus as of now.
What kind of roadmap you have right now?
In terms of roadmap, it's mostly a sales roadmap. So what we have done is we've sat down and worked on the product and the framework for the past 12 months, so to speak. So we have a solid framework in hand. It is very much like a business process management framework, so it's easily tunable to a lot of other industries. So net effect is massive scalability, massive repeatability. So in terms of roadmap, it's a sales and marketing roadmap. We wish to extend to other markets other than India. So at the moment, I'm setting up my regional sales office in Singapore to serve Malaysia, Indonesia, Philippines, and all these other countries in that particular region. And by the end of the year, we also hope to enter the Middle East market. So it's mostly a sales and business development roadmap that we have for as our target for this year.
Why don't you share some of the challenges that you guys faced initially to come up to this stage?
Challenges are of course there. When you're an entrepreneur and when you run a startup, you do come across people who think that it will not work and all of that, right? But if you're an entrepreneur, I think one of the key factors for an entrepreneur is more than passion, more than energy, and all of that. It's a persistence. So when people tell you it doesn't work, you do believe in your product so much that you think that it will work. That's really what defines an entrepreneur. So, does that answer your question?
Yeah. So, would you like to give any feedback or not feedback, so anything for our upcoming entrepreneurs, anything from you, any message from your side?
Well, one thing I would say is two things actually. One is be smart, be grounded. In marketing, I'm a marketing guy. In marketing, there's a phrase. It's called "Don't ever drink your own Kool-Aid." That means that don't think that you're the best in the world. Keep in
Right.
touch with the ground. At the same time, believe in yourself. Because if you're an entrepreneur, everybody will tell you that you will fail. But believe in yourself and do succeed. That's the message.
All right. Thanks, Rajesh, and we
Thanks.
at eLagaan wish you all success.
Thanks a
Thank
lot.
you.
I would like to thank eLagaan also for giving me this opportunity. Thank you. Thanks
Thank you.
everybody.
Thanks a lot.